Hey guys, it's Gianna, MidwiFay. Today I wanted to talk about 3 tips I have to help you avoid having a cesarean birth. Let's get into it. Okay, why do I want to do a video like this? You know, a lot of my videos come from things that my friends, my patients, my clients ask me. And a lot of people ask, how do I avoid a C-section? Now, let's just lay the foundation. C-sections are not bad. They are not the devil. I am a midwife. I work in a hospital setting. I know that C-sections are necessary in a variety of settings, and I am grateful that we have access to wonderful surgeons and anesthesia and hospital facilities when we need to for a C-section, okay? So I just want to say that first and foremost. I also want to say, we know there are all of the major organizations, the World Health Organization, the CDC, the American College of Obstetrics and Gynecologists, so the OBGYN's governing body themselves, the American College of Nurse-Midwives, all of us that work in this field recognize that the US C-section rate is too high. So we need to make efforts to decrease it. According to the most complete recent CDC data about 2017, the American C-section rate was 32%. Okay, so that means that basically almost 1 in 3 birthing people that come to the hospital are going to deliver by C-section. Okay, that is really high. The World Health Organization recommends they be closer to 15 to 17%. To put it into perspective, a cesarean section is the most commonly performed surgical procedure in the US. Okay, C-sections are performed more than any other surgical procedure. I believe it's followed by appendectomies, so taking your appendix out, and coronary artery bypass surgeries. So that's crazy that C-section is the #1 surgical procedure performed in America. Like I said, most health organizations realize that we need to decrease the C-section rate, especially the NTSV C-section rate. Okay, that stands for a NULLUP, first-time birthing person, who's full term with a single baby in there, not multiples, and whose baby's in the vertex or head down position. NTSV. That is going to encapsulate our low risk birthing people, and that C-section rate is still in the 30%. So when looking at the ways to avoid C-section, we have to know, why do C-sections happen? What are the 2 most common reasons for C-section in America? Those answers are prolonged labor and non-reassuring fetal heart tones in labor. So now that we know the 2 most common reasons why, we can start with my 3 tips. 1, this prolonged labor one. Okay, my tip is, do not go to the hospital until you're in active labor. Please watch my Sure Signs of Labor video. Talk with your provider about signs of labor. Take an extensive childbirth class where you learn about it. If you show up before active labor, there is such a higher chance that we're going to intervene, that you might be offered a labor augmentation, and that cascade of interventions will definitely increase your risk for C-section. So whenever we're talking about labor progress and labor timing, we have to talk about Dr. Friedman, who in the mid-1950s came up with the Friedman curve, which assesses labor progress. So it is how long should labor last? And he basically came up with a formula about how many centimeters should a woman be dilating if it's her first time or second, third time, every hour or whatever. So that's called Friedman's curve. There have been a lot of studies that have disproven it, and a lot of data that has said that labor is on a continuum of normal. There's a variety of normal for labor progress. However, there are still some hospital facilities and some providers who use Friedman's curve as a guide for labor progress. So we need to know if your provider is using a Friedman's curve definition of labor progress or one of the more recent updated definitions for labor progress. My other tip is to avoid unnecessary induction of labor. There is a push to encourage elective labor inductions after about 39 weeks, even for low risk people. I have a whole video on that. Please go watch that. I go in depth about why that may or may not be a good idea for you. But avoiding an induction unless it's medically necessary can allow your body to have the time it needs to go into labor on its own. Spontaneous labor has many benefits. It's usually shorter. It's usually gentler on the mom and the baby. It usually encourages that baby's in the right position. So instead of being induced or having your labor augmented at all, if you can arrive to the hospital with active labor and be in spontaneous labor, that's going to decrease your risk of interventions and definitely C-section down the road. So the first tip is to avoid having a prolonged labor, which means avoid showing up to the hospital before active labor and avoid induction of labor. Those are going to be huge. My second big tip is to avoid continuous electronic fetal monitoring if you can. Continuous electronic fetal monitoring is the practice of monitoring the baby's heart rate against your contractions continuously throughout your whole labor. This is standard of care and routine in most hospital labor and deliveries. So even if you are a low risk, normal, healthy person having a baby, not necessarily needing to be continuously monitored, it's routine for you to be strapped on to the contraction and the baby's heart rate monitor continuously throughout labor. There have been lots of studies that show that continuously monitoring baby's heart rate increases interventions throughout the labor and delivery process, including cesareans. And what it shows is it increases the C-section rate without having a better outcome for mom or baby. Why is that? You know, we're watching baby's heart rate. Baby's heart rate looks like a squiggly line. There's a couple different things we're looking for, making sure it's in the normal baseline, making sure it has fluctuations, that's something called variability, and making sure that it doesn't have decelerations, which shows us that baby can be having problems tolerating labor. What we know is that continuous electronic fetal monitoring has a high false positive rate. What that means is a lot of times it looks like baby is in distress. There's something concerning going on. We do interventions or we make the decision for a cesarean and the baby comes out just fine. Of course, that's a good thing when mom and baby are healthy. I'm not saying it's a bad thing that the baby came out fine, but all too many times we'll see concerning heart rate patterns, but we really don't know if truly something is wrong or if this is just a pattern that we're seeing. There are 3 categories that we use to interpret fetal heart rate tracings, and number 1 being A+, baby's 100% perfect in there, so we see. Category 2 is where the majority of laboring people fall, where there's some concerning things, but overall everything is looking reassuring. And then category 3 is universally agreed upon as a sign that baby is in danger. We need delivery like within the next 15 minutes or less, okay? So most women, like I say, when you're in labor, you're falling in this category 2 zone. And it's hard for us to know how many babies are truly compromised and how many are just having trouble here and there throughout labor. Continuous EFM is definitely a topic to talk to your provider about before going into labor. Ask about your hospital's policies if for a low risk mother, if you need to be continuously monitored. What's the hospital's policy on intermittent monitoring? So that is monitoring at certain points throughout labor, which data supports and shows as safer for low risk women. So we're still going to be listening to baby's heart rate, of course, and seeing how baby is tolerating labor. But what are the policies so that it doesn't have to continually be done throughout labor? So if you're avoiding prolonged labor, avoiding being in the hospital before labor starts, avoiding induction, if you are able to get intermittent fetal monitoring to monitor baby's heart rate at important times in labor as opposed to continuously throughout the labor, you've done 2 of the 3 things. The third is find a supportive provider. Okay, that sounds pretty basic, I know, but it is key to avoiding cesarean, to avoiding an unnecessary cesarean. how do you know if you have a truly supportive provider? You can take a look at my how to have an empowered hospital birth video. I talk about it there more too. But truly, it's important to know your provider's philosophy on childbirth. You can ask what his or her cesarean birth rate, what the hospital facility's cesarean birth rate is. I know where I work, my hospital cesarean rate is about the national average, a little over. But I also know that there are particular OB/GYN physicians and particular groups that contribute to that cesarean rate much more than others do. So don't be afraid to flat out ask your provider, what is your C-section rate? What is your facility C-section rate? What is your view of birth and C-section and normal birth for a low-risk mom? Of course, I will always say, if you can have a midwife, get yourself a midwife. Midwives have lower rates of cesarean birth, lower rates of interventions in labor and delivery. So if you can find a midwife provider, if there's a midwife that works in the group with your OB, if there's a midwife at your hospital, if you call your insurance and you find that they accept midwives, find where they are. It's worth it to find a midwife, if you can, to care for you, because that is going to decrease your chance of having a cesarean. And I'm going to put under the supportive provider category doulas. Doulas are not medical providers, okay? But there is a lot of data that says that the presence of a doula, the advocacy of a doula, the education support of a doula before labor as well as during labor can decrease your chance of having a C-section. Your doula can help you and your partner during early labor when you're still at home, help you know when the right time is to go to the hospital, help you know what questions to ask during labor as well as before labor. So I'm going to add doulas in there as being a part of your supportive OB team. So those are my 3 tips to avoid a C-section. Avoid prolonged labor, so don't be admitted too early, don't be induced unnecessarily. Avoid continuous electronic fetal monitoring if you're a candidate. You do not have to be monitored continuously throughout labor. Your baby's heart rate doesn't. We find that we've got a lot of false positives there. So try and get intermittent auscultation if possible. And 3, cultivate a supportive OB team from your provider, either a midwife or a doctor, asking specific questions about their C-section rates and their philosophies on birth, and getting yourself a doula to support you and support your partner through this crazy time that is childbirth. All right, I hope this helped. I'll see you guys next time. Bye-bye.